So how can we increase our height using the different methods that are available? Is there a possibility that you can increase your height once you have achieved your complete height after normal adult growth? So even if you are 22 years, 20, 30 years, or even 40 years old, when your height gain has stopped, once you have stopped growing after a certain age, is there a possibility? Yes, there are a few procedures available. Earlier, people used to use some hormones or something, but they always have some other side effects as well. It's not only your bones which grow to make you taller or longer, it's the other parts of your body also get affected by that. So that is why, to make it into a controlled method, to let you gain height by a controlled method, there is a surgical procedure. So now first of all, let's understand what is the science behind it, what is the philosophy or science behind it. This method has been in use for n number of years. For more than 75 years, this method has been in use, because it was first of all propagated by a Russian surgeon by the name of Gavril Ilizarov. So in his name, this same device or the fixator called Ilizarov fixator has been used since more than 70 years for various deformities, for making bone when there is a loss of bone segment in any of the limbs, and correcting all sorts of deformities, making the limbs straighter, and then also into making new bone. So the philosophy of this whole procedure depends on a procedure called distraction osteogenesis. So the whole idea is, this is your bone, and if you make a controlled cut in the bone somewhere around here, which is the most vascular part of the bone, and then we separate the two parts of the bone against each other at a controlled rate of 1 millimeter per day. So if you make them apart, get them apart by 1 millimeter per day by a device from outside, which is a fixator, which can be of different kinds, then at that rate, when the bone gets separated after a cut in the bone, new bone comes and forms in its place. So if you are separating the bone or making it distracted by 1 millimeter every day, you are actually gaining 1 millimeter of new bone every day in its place. So that gap is getting filled up as we make the bone ends separate apart from each other. So now this same philosophy can be used for making the bone for as much as you want, but there is a limit to what you can do. So if we want to say what is a safe limit of doing this, it could be anywhere from 2 to 3 inches in one bone. So 2 inches would mean 5 centimeters, 3 inches can go as long as 7.5 centimeters, but that's about it. That is the absolute limit up to which you can safely do. And as you do that at 1 millimeter per day, you can imagine it will take around 1 month for 1 inch of bone distraction. And so if you have to go from 2 to 3 inches, it'll take around 2 to 3 months. So in 3 months, if you distract it at the rate of 1 millimeter every day, you can actually get a gap of 3 inches, and in those 3 inches of gap, new bone is getting formed every day, but it takes longer for that new bone to become strong enough so that you can take a device out. So what we essentially do is, if we begin from the starting point, this is the femur bone or the thigh bone. If you have to make a lengthening of around 2 to 3 inches in the thigh bone, we apply a fixator from the outside, which goes in like this: 3 pins here, 3 pins here, and then 3 pins here. And from the outside, it is connected by a rod, which is called a monorail. So on that monorail, there are certain clamps which can move and distract the fracture. So we create a fracture around here. There's a clamp here, there's a 3 pins here, 3 pins here, and 3 pins here. So there are 3 different segments. You can selectively move the 2 segments apart by a distractor from outside, and that fracture that we have created keeps getting separated, and in its place, new bone is getting formed every day. So if it takes around 3 months for getting a length of around 3 inches, it would take twice that amount. So another 6 months after that for that new bone to become strong enough so that you can take out the fixator and let the bone be like that, and you can bear weight on it. So that is how long you would have to keep a fixator for around 3 inches of lengthening. You would have to keep it for around 8 to 9 months, that fixator on. Now, there's another way in which you can shorten the length of the fixator, because that is the machine which is from the outside, and its only work is to distract the fracture or the corticotomy. So that fixator can be taken out earlier if you have something inside the bone already which can provide stability once the fixator is out. That is called an intramedullary nail. So lengthening our nail is another procedure which we can do very safely, in which what we do is we put a rod inside the bone. First of all, we lock it proximally in the upper part. We put a couple of screws through the nail, and then we create a fracture here and apply a fixator from the outside. The fixator would distract the fracture or the corticotomy, get it to the appropriate length, and when you've got the complete length, you can take out the fixator, and at the same time you can lock the nail distally. So there are screws which can go through the nail at the distal end of the nail also. So that is what is another procedure, but it's a short procedure which gets you rid of the fixator once the job of distraction is done. So at around 2 to 3 months, when you've gained enough height, you can take out the fixator, and there will be nothing from the outside. And then the consolidation phase or the strengthening of the bone, which has to happen later, can happen on its own sweet pace, and you just have to wait for that to happen before you start putting full weight on that leg. So these are the few things that can describe how we do a limb lengthening procedure. There would be many other questions about it. You can get back to us for any other queries. There are many other aspects of this surgery, of this procedure, which need to be discussed before any patient commits to it, because it is a long procedure. It needs a lot of patience from your side. There can be some hiccups on the way, but if we do it under guidance, everything should come back nice. Thank you.